Hello everyone, my name is Terrance Rodrigues and I'm a first-year GI and Hepatology Fellow at Northwestern Memorial Hospital. I'm here today to talk to you about what living donor liver transplantation is. As you may know, living donor transplants account for over 5% of liver transplants that occur in the United States annually. Before discussing exactly what living donor liver transplant entails, let us first cover what the liver does in our bodies. The liver is one of the most important organs in our bodies and accomplishes many vital functions. It serves as a reservoir for vitamins, proteins, and other important molecules. It helps us regulate blood sugar by converting excess glucose into glycogen for storage. It helps clear the blood of drugs, poisons, and other toxins, and it helps produce bile, which aids in the digestion process in our intestines. Lastly, it makes proteins that help regulate blood clotting and also help our immune system fight infections. As you can imagine, when the liver stops working, these important functions are impaired, which leads to widespread consequences in the body, such as increased risk of bleeding, increased risk of infection, decreased clearance of toxins, and many other negative consequences. There are many reasons why patients may need a liver transplant when their liver stops functioning. Most commonly, liver transplant is needed because of viral infections such as hepatitis C or hepatitis B. Another very common reason for needing a liver transplant is chronic alcohol use. Increasingly, fatty liver disease is another very common reason for needing a liver transplant. Other people that need liver transplants are those with liver cancer, those that were born with congenital conditions, those that have bile duct diseases, or people whose liver stops working suddenly because of drugs or toxins. Now that we know a little more about what the liver does and why patients may need a liver transplant, we can talk about what exactly living donor liver transplant is. Living donor liver transplant is a surgical procedure that involves removing the diseased or poorly functioning liver from the recipient. At the same time, the donor undergoes a surgical procedure to remove anywhere from 25 to 65% of their healthy, well-functioning liver. This portion of the donor's healthy liver is then transplanted into the same space that the recipient's poorly functioning liver was removed from. Blood supplies and biliary ducts are reattached, and both patients move on to the recovery process. Due to the liver's unique ability to regenerate, both the donor's partial liver and the recipient's partial liver grow over time to become fully functioning, complete organs. This can occur in as little as 8 weeks. To become a living donor, there are certain requirements that must be met, which vary between transplant centers. But in general, you must be older than 18 years of age, be in good mental and physical health, have a blood type that is compatible with the recipient, have no history of liver disease, drug use, HIV, or cancer, and most importantly, must be willing to donate and be informed about the donation process and possible complications. For these reasons, most living donor transplants are from relatives or friends, but it is also possible to donate to someone you do not know. There are several reasons to choose living donor transplant over deceased donor transplant. For example, living donation is an excellent option for those who would be low on the deceased donor transplant list, but are having severe consequences or symptoms of their liver disease. There are also shorter wait times if a donor can be identified, fewer postoperative complications, and longer organ survival time. The survival 5 years post-surgery can be up to 15% higher with a living donor transplant as compared to those who get deceased donor transplant. Lastly, living donation can be a better option for those who have liver tumors or in pediatric patients with congenital conditions. Overall, living donation is becoming a more popular option in the United States, with over 524 patients receiving the life-saving gift of organ donation last year, almost a 30% increase from the year prior. Thank you for attending our poster presentation. We hope you learned something about living donor liver transplantation.